Hi, good morning, everyone. We are back on 128th CMAAO International Weekly Session. We have representatives from more than 19 countries in this association, and we meet every week for a common topic. During this pandemic, we have seen a lot of new advances, technology being implemented in medical system. One of them was how to give medicine while you cannot have a physical interaction with your patient. And one of them was telemedicine or telehealth. Telemedicine is where you use an electronic, computer, phone, or some kind of electronic instrument and treat patients digitally. So for this, we have our guest is Dr. Sunil Srinivasan. He is MD and a consultant pediatrician from Tamil Nadu. He's a past president of Indian Academy of Pediatrician. So I would like to invite him to give us some kind of a knowledge what's happening in India, and then followed by we can also talk about what's going on in the different countries. And after that, we will have few slides from Dr. Monica Vasudev on an update on what's going on in the pandemic side. Thank you. Over to you, Dr. Sunil.
Can I share my screen, please?
Yes, sir, you can.
Am I audible? Shall I start?
Yes, you're audible. Yes, you're audible.
Thank you. Thank you. First of all, my sincere thanks to Dr. Saurabh, Dr. Monica for all the introduction. I must confess I am not an expert in telemedicine. I am just a simple pediatric practitioner in a rural area in Tamil Nadu. And I was very scared of telemedicine. To be very frank, I had a good practice. But with Corona, I realized it became a necessity. I had to be in touch with my patients. So I'll briefly tell you something about telemedicine, but more importantly, I'll share my experience about telemedicine. Hopefully, it will be of some use to you. I know Dr. Bukhari also does a lot of telemedicine. He'll be able to share some of his insights. So let's plunge into that. So telemedicine is obviously a huge area. You can see from the big paragraph, but basically it all includes diagnosis, treatment, prevention, health education.
Telehealth. Can you put on the slide mode?
Yeah. Sorry, it is in slide mode, sir.
No,
okay.
You just need to put it on a presentation mode.
Yeah. Okay, sure. Is it all right?
So there should be a.
Okay. Not clear?
There seems to be some
problem here.
Okay. Yeah, we can't see the screen.
Is this visible?
I think we can continue, otherwise it's okay. We can continue.
I'm sorry.
It's okay.
Shall I make it full screen or this is okay?
This is okay. Let's continue. Yeah.
Okay, sure. So telehealth is again a much bigger subject. Consists not only of medicine, but also health-related services and self-care. So I'm just going to talk about a very small portion today, the top box, that is teleconsultation, my experience over the past 2 years, and hopefully I can share some insights into it. So in India, it began in 2001.
Dr.
Yes,
Sunil, your screens are not
able to see.
Blackout. It's a blackout.
Yes,
blackout.
Yes. Let me.
Yeah, can you please share it again?
Yeah, okay, I'll do it. Are you seeing the screen now?
Yeah, we can.
Very blurred. Your slides are very blurred.
I am very sorry. One thing what we can do, I have already sent Pinky the, maybe she can slide
Yeah,
from.
Pinky, can you share the screen for, can you share the presentation if you have it? Otherwise you can,
So sorry, I cannot share currently.
is it possible for you to just email me or WhatsApp me just around
Yeah.
right now?
I have the slides. I can share them.
Yeah, it is in Pinky's email. Yeah.
Oh, you have this?
I- I have the slides. I can
Yeah.
share them. One
Can you
second.
put it from your end? Thank you.
Yes, I can. Just 1 second. I just emailed them to myself.
So this is, so since like Dr. Sunil will share the presentation till he comes, this is the disadvantage of telemedicine also.
Yeah.
This is the, this is the, yes, this is the shortcomings of the telemedicine.
Yeah, and it is, I think it is an internet issue, I would say.
Hmm.
Dr. Sunil,
Yes, please tell me.
this is Alvin Chan from Hong Kong.
Hi, Alvin. Hi, Alvin.
The background show the Chinese village
Yeah, this is
behind you.
this is Wudong Mountains. Wudong Mountains.
Wow, yeah.
Wudong Mountain in China.
Yes. I'm a Tai Chi instructor, so this is my favorite shot. Yeah.
That is nice.
Yes, I've been
Yeah.
practicing for more than 14 years and teaching for the past 7 years. I teach Tai Chi, and so this is my favorite shot. Yeah.
Wow,
Thank you.
expert.
Dr. Monica, you want me to share?
I thought you are practicing in Tamil Nadu. Is that right?
Yes, Tamil. That's right, sir. Tamil.
Nice meeting you here.
Thank you, so sir. Is this
Everyone
visible?
see?
Yes.
Yeah, you can see all that? Yeah.
Yeah, we can see. Perfect.
Okay, but this is only actually what happened last night. Pinky sent me some additional slides which are not here. no
Oh,
problem.
yes, you have edited. Can you continue in the search mode what you are presenting already?
Will that be okay? Yeah. What I'll do is I'll finish that. I have these slides in my computer. So once I finish, I'll start sharing. Is it okay?
Actually, I'm getting the new slides. Let me just email them to myself.
Sure, we'll try.
and I will give them to you so that you feel that you have the slides that you need.
Pinky, the one you just sent me right now, is that an updated one?
Yes, actually updated.
Monica, I'll share it.
Okay, sounds good.
Okay, everybody can see my screen?
Yep, there we go.
Okay.
Yeah. So right, my apologies for this. Yeah. Sure. Okay. So telehealth, obviously much bigger topic, and obviously lot of. Can you go to next slide, please? Yeah, so I'm going to talk about teleconsultation, small box right in the top. My experience for the past 2.5 years. Next slide, please. Yeah, so we started somewhere in 2001 with the Apollo Rural Hospital linking up at Aragonda with Chennai's main center, and that's how we began telemedicine in India. Now lot of activities going on. Next slide, please. So we have a national teleportal, and we have some regulatory authorities there, and we cover both rural and urban areas. Next slide, please. Yeah, so not only it covers Western medicine, it also covers traditional medicines also too. Next slide, please. Yeah, some applications. I mean, enormous amount of applications. There is a program happening every day, or probably 2 or 3 programs every day in pediatrics alone. So I can imagine the volume of medicine going on. So tele-education, long distance learning, conferencing, what we are doing right now. You can train trainees. Next slide, please. Yeah, you can deliver all this at whatever various centers, schools, in prisons, and industries. You have even robotic telemedicine available. A surgeon from US can operate somebody in France with robots. I mean, it's amazing what uh, robotics have done and what telemedicine has. The next slide, please. So yeah, so you can monitor patients at home. They don't have to come to your hospital. We have now specialties like teleophthalmology, telecardiology. Next slide, please. Yeah, so we started in 2020, Government of India started a program called e-Sanjeevani, which is Digital India, and people could log in and you can talk to a doctor. I just checked today the e-Sanjeevani slide. It's amazing. They have treated millions of people. The waiting time is hardly 10 minutes, and doctor consults you. It's a great idea. I have not used. I have my own system, which I'll discuss. But for e-Sanjeevani, it's a great initiative for past 2.5 years. Next, please. So it is very clear. All of us know what are the advantages. Diagnosis, better reach is there. Continuing treatment, education. You have a lot of access to data, as Dr. Monica was telling. A lot of data is there. Next slide, please. So we'll come to some of the practical aspects. I am not a very theoretical guy. So let us see what we can learn today. Why do we need telemedicine now? No, Corona is almost over. In India, as Dr. Monica was telling, we don't see that many cases, and all of them are not very sick anymore. So doctors have resumed full-time practice. So why do we need telemedicine even now? Are there advantages of telemedicine over direct consultation? There are, surprisingly. What do you require? Payment gateways. What's the legality of this? What are the disadvantages? So we'll take one by one. Next slide, please. So then I'll discuss few practical scenarios which I face in my practice, and hopefully some of you, it might resonate with some of you. So I prescribe a lot of medicines, and then the patient has got down. She or she goes to their village, and either that brand is not available, or the dose is not available, or the pharmacist says, no, I don't have this. They are so puzzled. They don't know what to do. So this mother who goes there sends me a message through WhatsApp, like, this is my problem. If it is possible, I respond immediately. I even talk to the pharmacist sometimes, tell them, well, do you have this, that? It has revolutionized my practice. Previously, I don't know what they did, but past 2.5 years, their medicine prescription, at least they're getting the right medicine. Next, please. Another situation, all the investigation. I ordered some investigations. Patients have got that. Now they're asking, what is happening? Is my child okay? What's happening? So what I do is they just copy they photo the investigation, send it to me on my WhatsApp. Whenever I'm free, I look at it, and I'm able to respond. So it solves much of their anxiety. I'm happy to be able to connect to them. Next slide. Yeah, so this is a common thing. All children, they have rash, and the parents are quite, sir, is it mosquito bite? Is it allergic rash? Is it chicken pox? Should I bring the child to the hospital? So many questions. Well, this can be solved instantly. They just send me the photograph. I ask a few questions. I can reassure them or tell them what to do. So this great thing you can easily achieve by teleconsult. Next, please. Yeah, so this is not the patient of my photograph of my patient, but we see a lot of hypothyroidism here, and I've been following a lot of them. Now they are about 10 years old or 15, doing very well, taking their medicines. The only thing is, do they have to come all the way from the remote villages? Not needed. So I asked them to get a thyroid profile done. I look at them in video, and I just can fill up their thyroid thing. So not only thyroidism, I have patients with nephrotic syndromes, with purpuras, and so many patients who needs follow-up. We can easily solve this by telemedicine. Next, please. Yeah, this is at 11 p.m. at night, one mother is very worried. Baby is having diarrhea. Should I admit this baby? Looking sick. One look, I can tell you whether needs admission or not. So in other words, these are common situations we face. And in spite of our regular physical practice, this can be easily solved using our telemedicine. The teleconsultation, I'll discuss how do we do it. Next slide, please. Yeah, so I don't have to save. I mean, this is not a typical Indian bus, but it does happen in rural areas. There are few buses, and trying to get in that bus is a big ordeal. Imagine carrying a sick child in such rural buses. So saves money, saves time, and need not be synchronous. That means the patient's questions and my answers can be at different times. So we don't have to log in simultaneously. More accessible. I told you all about emergency care. Next slide, please. Yeah, requirements for a simple basic start. What I have done more than 3 years ago, I have a WhatsApp account. I'm sure all of you have WhatsApp account or at least similar kind of apps in your countries. You have a laptop and payment gateway. Yes, obviously we need to be paid. So these are three things. That's all you need: WhatsApp, your laptop, and a payment. With this, you can create wonders. And if you want more advanced, I have a clinical software in my hospital. My desktop has a software. And with the app called AnyDesk, I can always access my laptop. I can retrieve all my parents' data. The patient, all that needs to tell is his or her name, date of birth. I get the entire records from my hospital. I know that they got allergies or not, or what their vaccinations are, everything. So, and then another advanced version called WhatsApp Business Account. It has more additional features for those who want to, like Dr. Bukhari, if you are doing full-time telemedicine, go for this business account. It has many additional features. It makes your payment, retrieval, messaging very, very easy. It has something called broadcast facility. You can tell your patient, I am out of town, or this is what I have done, or this is, or you can advise your patient on what's happening in Corona. This broadcasting service is very good in WhatsApp business account. So there are a lot of advantages. Next slide, please.
मैं बाद में फोन करता हूँ मैं लेक्चर में.
So payment gateways, I know payment is a sensitive issue, but I thought I should mention it because we all need to be paid here. So I use Google Pay. I have other local like Phone Pays and our internet banking, but this works for me, works very good. I'm surprised even remote villages, grandmothers can operate Google Pay. In fact, most of the children I see, it's only the grandmothers who show the check. Because the rural area, the men, women have gone to the fields. The grandmother looks after. She's able to operate Google Pay. So it's a you just all you got to know is Google will help you to link your bank account to your gateway, and you're done. That's all. Pre or postpaid means in metro cities, some of my colleagues charge beforehand. So unless you pay, they're not going to consult. But I don't do that. Doesn't work here. So what I do, we do consultation, and whenever they can pay, they pay. And what is amazing is most of the rural guys end up paying. They're not defaulters, so no issue at all. If they can't pay, I don't mind. And if they send a receipt, everything is over. You are very clear that they have paid. Next slide, please. Yeah, how legal is it? So a lot of people have, my colleagues ask me, is it legal? Can I practice? Can I charge patients? Absolutely, yes. The National Medical Commission, which is our latest regulatory body, in Feb 2022 have told it's okay, it's legal, you can do that. The only thing is you got to follow certain guidelines in your prescription. Sorry, I don't think I have that, but let me see. But you have to have certain guidelines. You're going to have the patient's name, address, your address, phone numbers, your the medicines. If possible, you got to add local language, give them a plan of action, all this they want, but it's all doable. It's not difficult. If you have a software, everything is achieved. And you can certainly charge. There were some cases of people beating up doctors. Why are you demanding payment? You can pay. You're legally allowed to charge for teleconsultation. Next slide, please. Yeah, that's the prescription. Yeah, that's my. You can see my name, my hospital address there, all patient details. In the anthro vitals, since I have seen this patient physically, everything is there. But if you're not seeing, at least you can check a few vitals like hydration. You can check. You can take your respiratory rate, response. All this can be easily checked. Your medicines, and in local language this is Tamil for us. So all this needs to be in your teleconsultation prescription. Don't scribble something and send. Most of our handwritings are illegible, I can tell you that. Next, please. Yeah, so some etiquette is involved. So I learned it through trial and error. First, there are 3 calls to be made for any teleconsult. First of all, I call through WhatsApp and I ask, okay, can I see your child? Can I see your child through video? Is it okay? Are you comfortable? Be careful because videos are very intrusive thing. You're intruding into somebody's privacy. Be careful. The mothers might not be properly dressed or the conditions may not be good. So get the permission, number 1. The next call, then you check, visually check. You can easily, for pediatrics, we have no issue at all. I check the child, see the activity, vitals like hydration, that we can, or respiratory rate, or abdominal distension, the movement, the response to our calls, smile, all we can easily check through videos. And once that, then I have to explain. I call again and go, okay, don't worry, this is the problem, or you got to do this, that, and that. And once having explained, you send the prescription over WhatsApp. WhatsApp works wonderfully. Next slide, please. Yeah, there are a few disadvantages. I know that it is never like seeing directly. For example, very difficult to measure pulse or blood pressure or temperature. I know that. Auscultation, palpation, not possible. I agree. Some subtle clinical cues, we can easily miss it. And there, of course, problem as we had in the beginning, internet and electricity. But in spite of all this, I can tell you, this is WhatsApp, and it has permeated to the corners of society. I feel so bad. I should have started this years ago. You won't believe it. WhatsApp is not a very ancient thing. It came in 2015, 2015. That's all. It's only about 7 or 8 years old. But even this, I felt that after having this, after communicating, I think we have revolutionized my practice. I'm sure you would have learned something. I'm not a propaganda marketing guy for WhatsApp. They don't pay me anything. So there is no conflict here involved. I just want to share how nice it works. And all of us do. I talk to my daughters who are in United States. I talk to my grandchildren over WhatsApp. I thought, why not talk to my patients? And that's how the whole thing came. And it works well for me. I think that must be the last slide. Next slide, please. Yeah, thank you. Thanks very much. Thanks. Sorry, I rushed up a bit, but I thought I just conveyed the essence, and I am ready to answer any questions you want or anything you want. I'm sorry, it's a very simple kind of grassroots level technology, but I thought some of you could use it. Thank you. Thanks again.
Thank you so much, Dr. Sunil, for a wonderful presentation. I think this is the need of an hour.
Yes, thank you.
I will invite Dr. Monica and Dr. Chong, if he's there, to take up the session.
Thank you, Saurabh, and good to hear from everyone.
Yes.
And, yeah, I'm looking forward to seeing all my colleagues in Pakistan soon.
Yes. Can I give me permission? Can you give me permission to talk a few words?
Yes, please carry on, Dr. Bukhari.
Really, it was a really nice presentation, and no doubt it is the need of the day. But there are so many legalities in this telemedicine, and there are so many things that can be prevented and should be. The ethical issues are very important that Dr. Sunil, you discussed. And I will also suggest the PMA sitting in Pakistan, Dr. Nizami is there, Dr. Salma is there, that we have started telemedicine from the last 2 years because, because this we have conducted this session, I think 1 year earlier. During if you recall the memory, we have already conducted this one. Okay, second thing is that my 2 telemedicine experts are sitting here, and one of them is Dr. Mubashir. He is an expert. He can explain few this thing. It is not now difficult to take the pulse. It is not now difficult to take the blood pressure. It is not now difficult to hear the step using this, but the instruments should be there. If you allow me, I can request Dr. Mubashir and then Dr. Abed Karim to comment on this, the advantages of the advances of telemedicine through IT. Dr. Mubashir, can you comment? Dr.
Yeah,
Mubashir from Malaysia.
Yeah, please go ahead, and we will make it short because we will have a round of question answers and a morning
Words, yes.
also. Yeah, Dr. Mubashir, can you please?
Yes. Hi, good morning from Kuala Lumpur, and a very good day to all. Thank you, Professor Mulazim, and thank you for the organizers inviting me to talk a little bit. Actually,
It is Dr. Saurabh somehow, not me.
okay, hi, Dr. Saurabh. Thank you so much, Dr. Saurabh. So basically, if we look at certainly the most important issue is ethical, and when the payment is involved, actually it's a bone of contention. It can anytime result into some trouble for the doctors, that why they have charged and how much they have charged and on what basis and whether they gave advice. So that all the sessions must be recorded. And before doing any session, there must be a proper terms and conditions, and certain legal aspects must be covered through a simple agreement. Even they just touch some screen and say, yes, I agree, there will be no legal action taken, and all those stuff must be covered. That's very important in starting even a simple phone call, with the idea that we are giving even free consultation, giving and patient taking a step and resulting in some disaster can basically backfire. So that's most important. Thinking of what technology can do today, I am basically testing an app from Britain, which is on just viewing your face through plethysmotopography. One can check blood pressure, SpO2, heart rate, the level of anxiety. There are 8 different vitals which can be just picked within like less than a minute. 30 to 40 seconds, you can do all these readings, and they are plus minus 3 degrees variation. So at a heart rate of 60, they are accurate. At a heart rate of 180, they are accurate with a plus minus of 3. With more than 90% of the records, they show for hundreds and thousands of data that they are accurate on it. So we are talking about an era where 5G is coming. 5G is going to certainly outpace what we are able to do through telemedicine, through technological advances, through the different gadgets we have in the app in our phones. So it's a limitless, sky is the limit field, but there are so many implications. Thank you. I think it will continue. Thanks a lot. Thank you. Thank you.
Thank you so much. Very valuable points. And who's the next speaker, Dr. Bukhari?
Dr. Abed, few minutes, very few minutes, very shortly. Dr. Abed.
Yes, sir.
Yes, Dr. Bhagat, go ahead. Dr. Abid,
Sorry, sir.
Yeah, please go ahead.
Dr. Abed, we are not hearing you.
I think we can ask him to come back again.
Yes, yes, no problem.
Yeah. So I think before I can invite Dr. Monica, I think I am very closely linked to this topic because I think I was the initial person where a name which started this meeting, Dr. K.K. Agarwal, who started the telemedicine concept in India during the pandemic when everybody had a fear of coming out. So I just want a minute to tell what he did, and without saying what he did, I think this meeting would not be concluded, I would say, anywhere. We did not have data on what's going on in COVID during that time. We were not aware what's going on. We were not, because it was a pretty new issue which was going on. So what he did was he invited everyone as a raw data, probably hundreds and thousands of people coming on the forum. And we asked what is going on, what is the day 1, 2, day 2, day 3, day 4, day 5. And he analyzed those symptoms, he analyzed those problems, and he came up with a consensus statement what's going on. And this was way ahead of any medical association which was bringing, and this was also the data which was coming from all around the world. This is one of the benefits which I wanted to discuss about telemedicine, that the reach was so high, the availability of data was so high that you cannot expect that in any single hospital or a physical hospital. So I wanted to pay a tribute to Dr. K for starting that telemedicine in Indian part. Over to Dr. Monica.
Thank you, Saurabh. I was just wondering if Dr. Karim was able to speak now. I believe he's got audio. Did you want to, did you have something that you would like to say?
यार ये मीटिंग चल रही है, मैं इसमें बात करना चाह रहा हूँ। कैसे हो?
Professor Abid, are you there?
Okay, I think he's still having some echoing and some audio. He's going to, let's see if it, I can see his video now. He's on a different device. Dr. Karim, would you like to speak right now and share your knowledge regarding telehealth?
I think he would take some time to settle. So
Okay. So what I'm going to do is I'm just going to share my screen. I have a few slides that I want to share. And so just to thank Dr. Srinivasan for a fantastic presentation. And the reason we brought back this topic is to come back to say, what are we talking about today when the pandemic is in a different phase than with the onset of the pandemic, where we first realized the benefit of telehealth? What he has shown us is the beauty of the simplicity and the accessibility. And he also gave us some very valuable practical tools regarding billing and some apps and that he's utilized that I think a lot of us are going to walk away with saying, maybe we need to look at this. I just wanted to dovetail on what he said and talk about why are we talking about telehealth, whether it be video or audio communications, is that we really truly are talking about anybody, anywhere, and anytime. And so this really is allowing us to address barriers to health, access to healthcare. And that is the most important thing. The pandemic taught us many different things. And what it also showed us is that there was inequity in terms of access to healthcare. And using telehealth was one way to be able to address that inequity. I mean, there are issues still related to technology access, but even if you're using a telephone, that is another way that you can interact with a patient. This is just to show you the financial revenue related to the telehealth market in North America. And that all I wanted to show with this slide is that it will continue to grow within the pandemic, and that it has accessibility for primary and ambulatory care, where it could be on-demand or outpatient referrals, even in acute setting for tele-ICU. We've seen tele-ICU that has predated the pandemic, surgical and medical support, somebody's going home, looking at a wound to see whether it needs to be seen. And then for the post-acute and remote care for transition of care, somebody who's discharged from the hospital or remote patient monitoring. And I just wanted to talk a little bit more about what are we talking about now in this post-pandemic world. We're not totally yet out of the pandemic, but where do we see that the use of telehealth may be beneficial? Dr. Srinivasan shared his personal experience, but what I'm seeing with telehealth is that it also depends on the type of specialty of what you're in. There are some specialties, and just by nature of what you're doing within the specialty, which lends itself to using telehealth more. Think about your mental health patient, depression, anxiety, not going into a psychiatrist's office, but also making sure that the patient feels safe in the space that they're communicating through their screen and nobody else is listening. Somebody who just needs to follow up with a local hemoglobin A1C that's drawn, looking for diabetes care, versus the diabetic that needs to have a filament test to look at their feet. Or versus a neurology patient, somebody with multiple sclerosis who needs a full neurological exam. there's going to be different applications of telehealth, and we're going to see the difference widening with time. What other ways do we see telehealth working? I have patients that will say to me, I'm choosing to do a virtual visit because the price of gas has gone up so high. And I think for a refill of inhaler, for example, I'd like to just do my visit virtually. Or they might just alternate in person and virtually. Another virtue of the telehealth platform is getting second and third opinions by experts that are not in a regional area that's close to you. You can get it internationally, you can get it nationally, someone who can just review the data that has been collected by another person. And it also brings in the opportunity in a virtual visit to bring in family members who can extend the knowledge gained from the visit so that you have multiple people that are connected different places. So what are we looking at in the future of telehealth? We do see, at least where we're seeing where there might be a shortage, we're experiencing a shortage of primary care or the medical home, what we so to speak, the person who's integrating all the information from the subspecialist. It might be a boosted primary care model. It really gives the ability to reduce the cost of healthcare, improves access, especially to specific underserved communities. And then this was touched upon and alluded to earlier today in the conversation, which is to navigate the legislation and the legalities associated with what we do. And we need to be very aware of what they are in the areas that we're in and how they are changing. So talking about telehealth also talks about what is the future of healthcare. And I just bring this up because this is a recent article that came just in this past week that in Amazon now, that Amazon is getting into the healthcare market. And now we're going to see more innovative ways that healthcare will be developed, that will be delivered to patients. I also wanted to just kind of segue, if it's okay, if I may, just to give a very brief update on some other healthcare topics that are in the world. We are noticing fatalities related to monkeypox. There were at least 10 countries that are reporting fatalities. They've been seen in patients who've been immunocompromised. They've also been cases of encephalitis, and we've seen neurological complications that are rare, but they are occurring. And the thought is that the site of body of first contact, if it's skin versus mucosal, may dictate the severity of the disease. This came out from the Morbidity and Mortality Weekly Report from the CDC, just as a graphic to show that neurological complications are rare but possible. Just talking about COVID now and looking at where we are in terms of just crude and data in terms of mortality, in terms of hospitalizations, primarily hospitalizations due to COVID or with COVID-19 as an associated diagnosis, or non-COVID hospitalizations, and we can see that the numbers are slowly improving. I'd like to bring up the concept of NOVID. This is a new concept that's come out this week, this past few weeks. The NOVID is a term for somebody who has never had COVID, just like they've looked at HIV and the CCR5 in terms of changes in the immune system that makes them less likely to get HIV. They've been trying to find something similar with COVID. At USCF, there is a researcher by the name of Jill Hollenbach, and she tested multiple people, thousands of people who had been infected with COVID with absolutely no symptoms, and they were found to clear the SARS-CoV-2 virus very efficiently. What she found was that there was a mutation in the HLA genes that had T cells that were pre-programmed to fight off infection. And these were in individuals who had had a different coronavirus infection in the past. So that's it for my updates. Thank you for letting me speak a little bit broader than telemedicine. And I hope I was able to add something.
Thank you so much. And now we can open the question answers round. Dr. Chong, I think you have a question.
Not really, but we actually have quite a extensive telemedicine rules and regulations in Singapore over the last 2 years because of the necessity of COVID and telehealth. Some of the, I remember doing a training module by our ministry on telemedicine. It was mandatory. There were a lot of conditions that we had to put in place. For example, some of the simple things I can remember off the top of my head is that you need to know exactly where the patient is. In case the patient collapses or whatever, you need to know the exact location. Example, things like that, which you never really think about, so that you can always activate emergency services to go to them. That's one example. So you really, really need to know where the location of the patient is, because they could be anywhere. They could be walking around on their phone or whatever. Other things included things like recording it and so on, and also a lot of medical legal aspects of it. And plus payments were also another big area of difficulties. So for example, it was stipulated that we should collect the payment upfront before we do the telemedicine. It's actually stipulated in our rules, you know, for whatever reason. So there was a whole bunch of, there was a whole training module on telemedicine before we were allowed to practice telemedicine. So I can't remember off the top of my head because it was so onerous. There were so many aspects to the module. But if I can get hold of the module's content, I'll be happy to share it with the group. Thank you.
In fact, I have a question for everyone. Like, is telemedicine or a telehealth also for an emergency health, or is that only for a routine medical help? Is that like, because when Dr. Chong said for collapsing a patient, is that telemedicine also, people are like, doctors are also looking for where it's so acute emergency?
Let me just clarify, Sarab. Why you need to know the location is because who knows, right? The patient may be just talking to you and something may happen to the patient. So you need to know exactly where they are so you can activate the emergency services to go to their help. Because, I mean, the guy could be talking to you and collapsing, right? You know what I mean?
Yeah,
I mean,
in fact,
some
lot
patients,
of
yeah.
a lot of technology is coming where, you know, like Mr. Mubassir was saying that, in fact, a lot of technologies which I am aware is coming that, you know, you can buy those equipments or you can rent those equipments, you can put it, and that gives the data to the doctor, and the patient just need to, like, let's say a BP apparatus or, you know, some kind of a molecule here, you just put it, and you know, that gives a complete data for what it is. In fact, eye scanning is coming also, where those advanced technologies will be able to give you the you know, that technology advancement is there already in that front.
Yeah, thank you.
Dr. Abir is here, I think. Dr. Kareem, you would like to speak now? You need to unmute yourself.
Yes, good morning, everyone. Sorry, I had some connection problem during the first talk when Dr. Bukhari asked me to give comments. I'm sorry for that. And that is one of the restrictions or limitations of telemedicine also, that you can have sometimes net problem and other things while you are consulting a patient. I just wanted to discuss regarding we have started a new model here in Pakistan, in our country, and in Kashmir also, in our Azad Kashmir also. And that is that we are introducing the telemedicine van also, which will overcome at least some of the difficulties regarding emergency care of the patient. This telemedicine van can be working around the areas where even internet connections are not available. It will be equipped with the satellite connections, and the poor people, underprivileged people living at remote areas, having no access to the internet and other facilities, they can get connected via this telemedicine van, where at least some health workers are there to guide them, with the senior consultants sitting in our tertiary care hospitals. So I think that will be a good addition to this telemedicine system. And another thing is that here in our country, in our area, we are just starting this telemedicine free of cost. Our consultants sitting in our teaching hospitals tertiary care hospitals, they will be coming to our medical college in Azad Jammu and Kashmir Medical College, Muzaffarabad. They will sit there for about 8 hours in different shifts. And we have categorized 12 areas, 12 help desks regarding that. One is dedicated for surgery, medicine, gynae-obs, pediatrics, skin, and all those common ailments. And one is fixed for a general medical practitioner, where anyone can contact if he or she doesn't know that what type of consultation he requires. And that general medicine help desk can help them directly or may also guide them to contact the other person. We are having dedicated WhatsApp numbers for each counter, and the person will contact directly to the consultant on the dedicated number, which will be widely, publicized soon, inshallah. And second thing is that this telemedicine is going to revolutionize the difficulties which we faced during COVID, and we had very successful implementation of this telemedicine when the doctors were reluctant to have a face-to-face contact with the patients, and the health workers were also reluctant to have a face-to-face contact with the patients. So we, besides getting charges from the patient and making it a success like that also, we should also make models or legalities while considering the formulating the legal modules for that. We should consider this also, that how we can help the poor people, or some donors can add to the accounts of the consultants while they are consulting on the behalf of those underprivileged people like that. Okay, thank you.
Thank you, Dr. Sorab. We are also going to, I will advise the people in the telemedicine is one of the best tool, no doubt. And automatically there will be legal. I request on this forum that you raise the voice from the word that every country should have some legality or some rule and regulation use this to stop the malpractice or stop the misuse of the videos. And second thing is that we are giving the concept new. This is the totally new concept of the tele-laboratory, tele-lab, that inshallah we will once introduce this on this forum, that WHO is cooperating with us how to start this new modalities of the. In this way, no doubt, as the Dr. Monica told that Dr. Amazon is coming, the new world is evolving and the things are very coming, and that you can save the time, you save the patient, and you give the better benefit to the patients, even in the teaching. Thank you so much.
Thank you. And in fact, we can have a session once again on the legal aspects of telemedicine, which I can look for somebody who can have a knowledge for all the countries or something like that, or probably other, we can invite associations to speak on that and we can prepare that topic.
Absolutely, absolutely.
So every association can bring like a couple of lines speaking on telemedicine and the legal health. Yes, Dr. Alvin, you would like to speak something?
Yes, thank you. I think for us in Hong Kong, where medicine is really so accessible to most of our citizens, and then yet the telemedicine is still necessary, because in the pandemic situation, now we had, even after the pandemic had been rather been controlled, there is still a need for it. But then we must be careful about the medical legal consequences. That is, many patients in Hong Kong, as well as in the States, I think, are ambulance chaser. So now, in a way, telemedicine usually will not be for those ambulance chasers, but they are still legal suit chasers. So doctors are very vulnerable in such an aspect. So in Hong Kong, we had some, sort of guidelines or precautions that our doctors will need to be careful about. Say, for example, we advise that doctors need to be sure that he is really communicating with the real, actual patient and not someone who impersonated the patients. And sometimes we doctors are very energetic, we are very helpful, we are warm-blooded, just eager to help. But then some people are really malicious and they could really deceive us and cheat us. And, so we have to establish a credible doctor-patient relationship for the telemedications, consultations, say, because we sometimes have to give the medical advices to the patient or the guardians of the patients. Then we have to be very careful. Every advice we are giving could make us vulnerable in the court if the other side really, make complaints. And so we need to be fact specific, and we need to identify each other. And of course, it's very good that just now Dr. Sunil has advised us to have recording. And first get the consent to have the recording, and then we really have to record it. And because after all, when they complain against us, surely they would have their recording, even though they have secretly recorded you. That recording will be an evidence in the medical council. So I think, of course, it's not really mandatory that you really have a personal consultation with that patient before. That is, we accept new patients in telemedicine. But in accepting new patients, I think, first of all, we still have to know that we need to establish a doctor-patient relationship with that new patient through telemedicine. And then with that doctor-patient relationship, we also need to know that we could not just communicate with the guardian and that would be sufficient for our defense. I mean, we have to communicate with the guardian, but we also need to see the pediatric patient or the infant patient as well. Sometimes, of course, the telemedicine just involves the mother or the father because the child couldn't present their case to the doctor. But in telemedicine, it would be dangerous for us if we just talk to the guardian and without seeing the real baby at all. So sometimes as pediatricians and eager to help, we are very easily trapped. Sometimes just talking to the parents and thought everything is real. But sorry to say that when the parents want to make complaints, we are very susceptible if we don't really see the real patient or the infant. So, but it's really very difficult sometimes because, say, we are in Hong Kong, when a patient in Canada consults us, and the mother is very busy and the baby is crying, and then she would ask our advice, and then time is really running short. Then we just skip some steps, and that could be dangerous for us. And of course, we have to be especially careful if we need to issue certificates. I mean, when we have any telemedicine consultation, we should assume that we have to document very clearly everything. And that means we could issue certificates. Well, but then still, if we have to issue certificates, then you need to be 200% sure what you are talking about. Seeing the patient is, first of all, the real patient, not impersonated, and the video will not be edited by the complainant later on. These are all in Hong Kong. It's difficult because we see so many online online crime nowadays. We doctors need to be careful as well. And so I think we need to be careful about the medical legal consequences. That is the crux of the matter. Thank you.
I think one point we have all missed out is, which I know is very important. that every telemedicine should be followed by a written prescription, which also should say that what all has been discussed, what is diagnosed, and what has been prescribed. That is also a very important legal aspect of telemedicine. Dr. Muzukwa?
Thank you so much, colleagues, and thanks for the excellent presentations from our speakers. I think, you know, I like the part that we emphasize on the legalities around telemedicine. But also considering, especially in my country, where you find that telemedicine by patients at times is not taken as a full normal consultation, in such a way that they don't see it. Even some funders don't see it as a full consultation where a doctor should be paid the full amount. But now, if you look at it, not only do you provide the platform, but also you need to make sure that there's prescription. If there's a need for a medical certificate, you also issue out that. Lastly, you know, I'm just highlighting the administrative work around telemedicine. But also, you know, it does not indemnify you, the fact that you are doing telemedicine. So I don't see why it should be justifying lower consultation fees, because, you know, the amount that is the work that is being done is equally is equal to what you do in normal consultation, including when it comes to litigation. Thank you so much.
Thank you, Dr. Muzukwa. And I think Dr. Sunil has to leave for the hospital. So I would thank you for his presentation and his time over here. Thank you, Dr. Sunil. And if in the interest of time, if there is any other speaker, if anybody wants to give a comment, please go ahead. Otherwise, we can wind up the session. We are running late. So from today, we are making sure that the presentation and everything remains in 1 hour time, in the interest of time for the doctors, because I think more than telemedicine, the physical clinics have also been started out.
Saurabh, excuse me. Can I take this opportunity to ask our colleagues in Pakistan Medical Association, you know, next week there would be the CMAAO General Assembly in Karachi. So I could not go to Karachi personally. So I will do the Zoom presentation and also report of the financial statements and the budget. So I just want to ask that, do we have to present the country report and the symposium topic in the meetings? I don't know whether the time slot were arranged for that, or we don't really need to present it personally, just give the report. That will be sufficient.
Is anybody from Pakistan Medical Association to answer this?
Thank you very much, Saurabh.
Yeah.
First of all, I appreciate Alvin. Thank you very much for your question. Yeah, Alvin. Although I find I'm not of the main organizers over there, hence I live in Lahore. But I think it is a very routine matter what we did in the last times in the CMAAO. Your presentation can be online, and that has to be accepted. I'm very much sure about it. As Dr. Chong is coming to Pakistan, and as he said, and we are waiting certainly, and I'm leaving for Karachi on the 22nd just to receive Dr. Chong as a guest and as a chairman of the council. And as far as the telemedicine, if we can prescribe telemedicine or this e-medicine, I'm sure, Alvin, your report will be accepted, and certainly we can discuss over there. It could have been better to see you in Karachi and somewhere in Pakistan, but hence you are not able to attend this meeting. So I believe no worries. It is going to be as far as the program is being scheduled, and program is being issued by CMAAO. And there is, as usual, we have the presentation of the treasurer as finance. You are being the chief of finance. So that will be accepted, definitely. If any question or query, I'm sure Dr. Kazi, he can share with you. And if there are any questions from Kazi or any, electronic or all these expertise, that will be available at the conference. That make sure. That is definitely. So as far as your question is concerned, the presentation, the report, and report will be there. Yeah.
I would like to
and
say,
Saurabh, having this floor, I
have to apologize that I could
Yes.
not go to the Pakistan Medical Association assembly this time because I had the whiplash injury. You know, last time I had the head injury and then the bruise all over my orbital areas. But in fact, it's the whiplash injury that is most traumatic. And so I could not really survive there. But then I would also like to know the situation in Pakistan, whether I would also have a proposal in the AOB that whether CMAAO should make a donation to PMA because of the devastating, the flood. I just think that in the past decade, say in the tsunami in Indonesia, and then for the flood in Bangladesh about 10 years ago, and then Myanmar also, we had made donations to the medical association in that nation to provide charity, rescue, and other help. And I just don't know whether it's necessary, and it's whether it is appropriate. So I just thank you very much for your concerns. And I am recovering, but then my whiplash injury still hurt. Thank you so much for all your kind words.
We all pray for your rapid recovery.
Yes, we pray for your speedy recovery.
Saurabh, can I respond to Alvin as far as the flood area is concerned in Pakistan? We are passing through a very hard time. I request, as Dr. Chong is also, I can see him. As far as Pakistan, half of the Pakistan is now been in flood areas. People 1.3, it is about 330 million people have been now suffered from these flooded areas. Two of our provinces are very badly hit. Partially the both two provinces, that is the Punjab and KPK.
Dr. Nizami,
and I will appreciate taking the traditions of the CMAAO as we have been doing for all those areas. And as far as in the capacity of Pakistan Medical Association, we and our branches, we are doing well as far as the health is concerned, and certainly the other things which are needed over there in the flood hit areas. I'll appreciate, and rather I put a request officially as Pakistan Medical Association representative to CMAAO to help out the needy people at this moment. Thank you, Albert.
Our prayers are with you, Dr. Nizami, and I think we all are with you. I understand more than 1,500 lives have already been taken off for that. So that's something which, we all pray for a fast and, complete settle down again. So, Dr. Chong, can we wind up and with your thank note?
Thank you very much. Always good to see everyone at these Saturday meetings. And I look forward to seeing all my Pakistani friends in Karachi soon. And to a good CMAAO General Assembly. Take care, Alvin, and hope your whiplash gets better soon.
Thank you so much.
Thanks, Monica, for the presentation, and Dr. Sunil.
Dr. Chong, we are eagerly waiting for
Thank you, Chong. Thank you.
We are eagerly waiting to say you welcome in Pakistan.
And special thanks to Dr. Monica for getting up at this time and adding a valuable comments in this presentation. Thank you, Dr. Monica, for being with us.
Yeah.
Yeah, thank you, Monica.
Monica.
Thank you
Thank
so
you
much.
all for your meeting next week.
Although I miss so
Thank you.
many meetings, but I am ever following you.
So anybody who misses the meeting would need to get to speakers.
Dr. Saurabh, my students are sitting here. You can see from the final year MBBS.
Thank you. And also Dr. Musabir and Dr. Kareem for your valuable comments. Anybody who misses the meetings from today needs to give a presentation next week.
Thank
Prof,
you.
Prof, can I just ask, Prof. Ashraf, can I just ask how's the situation in Karachi itself, the city?
Weather is beautiful weather, and the beautiful oceans.
You don't worry about it, Karachi. Navigation from airport to the hotel. Feel free, that will be comfortably. You will be no worries at all. And moreover, Chong, I'll be over there before you. So you should not worry about it.
When Dr. Nizami is there, we think there is no worry.
Sounds good. Looking forward.
Thank you, gentlemen, for being here. We will wind up this session. See you again next week for 130th session. Thank you.